The impact of the pandemic has been devastating to communities, especially during the third wave, where the COVID-19 cases have been on the increase, coupled with terrifying high number of deaths. This, according to the initiators of this project, are just not numbers but lives that have been lost as a result of the pandemic. Of late, families have been burying not only one but multiple members from one home in one day without time to mourn properly. According to Anthony Ouhap, one of the COVID-19 counselors, this can have long-term effects even after the pandemic if people do not get psychosocial support.
I could not have imagined, even though I knew about it, the level of sadness, the darkness that's hanging there like a cloud over our community. There are people who have lost 10 family members in the space of a year. So counseling will be important in the time that comes. We have so many household, family setups that have not grieved properly, that have not gone through bereavement counseling, that have not received help. And that in itself creates so many other problems.
The team has been mostly offering free telephonic and virtual counseling, and the response has been overwhelming. According to the initiators, some people just want to talk and be offered a listening ear. The network has extended to other towns, and services are currently offered at the coast and northern parts of the country and continue to grow on a daily basis.
So our role is mostly to listen to what the person is going through, allowing them to experience these emotions and finding a safe environment in which you can talk about the experience that you are having. Many times people would ask questions and look for solutions. We don't provide solutions all the time. It's not a place of giving advice, but coming up with a plan that will help the person to be able to move towards a place where they can start reorganizing life. We would want to have possible support and furthermore a 24-hour system of people that can just sit there and they just listen to you. This is what we are planning now.
The team also offers referrals to cases that are intense and need further assistance.
There are limitations to the process as well because there are certain acute incidences that grieving in itself has got a timeline and the time period, of course, the intensity thereof. So then there are people that don't, when it becomes too much and it is not something that you can now, it interferes with your daily functioning and such. That's where we also do referrals to a network of psychologists and say that, okay, go and see this person. People would ask medical questions and talk about what they are doing, and then we explore what they have done, whether they've gone and seen a doctor. And so it's a conversation where we also work with a referral system.
Those in need of counseling can contact the following number, 081 206 1223. Selima Henok, NBC News, Windhoek.